Toxoplasmosis is an infection caused by a tiny parasite. This parasite is called Toxoplasma gondii. It is a single-celled organism. Many people who get this infection do not feel sick at all. Their immune systems are strong. They can fight the parasite without showing any symptoms. However, the parasite stays in their body for life. It stays in a dormant or inactive state. For most healthy individuals, this does not cause long-term problems. The infection is very common around the world. It is important for nurses to understand what it is. Prevention of toxoplasmosis is a key part of nursing care. Nurses are on the front line of patient education. We have a vital role in teaching people how to stay healthy. By providing clear and simple information, we can empower patients. We help them make safe choices in their daily lives. This is especially true for certain groups of people. For these individuals, a toxoplasmosis infection can be very serious. Therefore, our educational role is critical. Preventing an infection is always better than treating one. This proactive approach protects patient well-being. The reason prevention is so important in nursing is because of the potential for severe harm. While a healthy person might not even notice they have been infected, the consequences for others can be devastating. This includes unborn babies and people with weakened immune systems. As nurses, our primary responsibility is to protect our patients from harm. This principle, known as non-maleficence, guides our practice every day. Teaching about toxoplasmosis prevention is a direct application of this core nursing value. It is a simple intervention with a powerful impact. It can prevent lifelong disability or even death. So, our goal is to make every patient aware of the risks. We need to provide them with the tools and knowledge to avoid this parasite. This essay will give you the essential information you need. It will help you teach your patients effectively. We will look at who is most at risk. We will explore how the parasite spreads. Most importantly, we will outline the clear, practical steps you can teach for prevention. Remember, good patient education is a cornerstone of excellent nursing practice. It is how we help people take control of their own health and safety. The most significant at-risk group for toxoplasmosis complications is pregnant women. Specifically, it is the unborn baby who is in the most danger. If a woman gets a toxoplasmosis infection for the first time while she is pregnant, she can pass the parasite to her fetus. This is called congenital toxoplasmosis. It can cause serious health problems for the baby. These problems can include damage to the brain, eyes, and other organs. The risk of passing the infection to the baby is higher later in the pregnancy. However, the severity of the problems is often worse if the infection happens early in the pregnancy. Another major group at high risk includes individuals with weakened immune systems. This is also known as being immunocompromised. People in this category include those with HIV or AIDS. It also includes patients undergoing chemotherapy for cancer. People who have had organ transplants and are taking immunosuppressant drugs are also at risk. For these individuals, their bodies cannot fight off infections effectively. A new toxoplasmosis infection can become severe and widespread. It can affect the brain, leading to a condition called toxoplasmic encephalitis, which can be fatal if not treated. For people who are immunocompromised, a past infection can also be a danger. As we mentioned, the parasite can lie dormant in the body for years after an initial infection. If a person's immune system becomes weak later in life, this dormant infection can reactivate. When it reactivates, it can cause serious illness, just like a new infection. This is why it is important to know a patient's history. We must be aware of their immune status. This knowledge helps us to provide the right advice and monitor for any signs of reactivated disease. Nurses play a crucial role in assessing patient risk. Therefore, when we are caring for these specific patient populations, our vigilance must be heightened. Patient education on toxoplasmosis prevention is not just helpful, it is essential. For a pregnant woman, this education helps protect her unborn child from potential birth defects and long-term disability. For an immunocompromised patient, it is a life-saving measure that can prevent a severe and potentially deadly illness. As nurses, we must be able to identify these at-risk individuals and provide them with targeted, clear, and supportive guidance to keep them safe from this preventable infection. One of the most common ways people get toxoplasmosis is through food. This happens when a person eats raw or undercooked meat. The meat can come from animals like pork, lamb, or venison that were infected with the parasite. The parasite forms cysts in the muscle tissue of these animals. If the meat is not cooked to a safe internal temperature, these cysts can survive. When a person eats this contaminated meat, the parasite is released in their body, causing an infection. It is also possible to get it from cured meats, like salami or prosciutto, if they are not processed correctly to kill the parasite. Another significant route of transmission involves cats. Cats, both domestic and wild, are the main hosts for the Toxoplasma gondii parasite. This means the parasite can only complete its full life cycle inside a cat. An infected cat sheds the parasite in its feces, or cat poo. It sheds them in a form called an oocyst. These oocysts are not infectious right away. They need to spend 1 to 5 days in the environment to become infectious. People can become infected if they accidentally swallow these oocysts. This can happen after cleaning a cat's litter box without washing hands properly. The environment itself can also be a source of infection. Because infected cats pass oocysts in their feces, soil can become contaminated. This includes soil in gardens, children's sandpits, and public parks. The oocysts are very hardy and can survive in the soil for over a year in the right conditions. A person can get infected by touching this contaminated soil and then touching their mouth. This is why gardening without gloves can be a risk. Similarly, eating unwashed fruits or vegetables that were grown in contaminated soil is another way the infection can be transmitted to humans. Finally, it is important to know about a few other less common routes. A person can get infected by drinking water that has been contaminated with oocysts. In very rare cases, the infection can be transmitted through an organ transplant if the donor organ came from an infected person. It can also be passed through a blood transfusion, though this is also extremely rare. Understanding these main pathways, undercooked meat, cat feces, and contaminated soil, is the first step for a nurse in teaching effective prevention. We must explain these routes clearly to patients. When educating patients, start with food safety. This is a critical area for prevention. Advise patients to cook all meat thoroughly. A food thermometer is the best way to be sure. Whole cuts of meat should reach an internal temperature of at least 63 degrees Celsius, followed by a 3-minute rest time. Ground meats like mince should be cooked to at least 71 degrees Celsius. Tell patients to freeze meat for several days before cooking, as this can also reduce the risk. All fruits and vegetables should be washed thoroughly before eating, especially if they will be eaten raw. Also, teach patients to wash cutting boards, utensils, and their hands with hot soapy water after contact with raw meat. Next, provide clear advice about pets, specifically cats. For at-risk patients like pregnant women, it is safest to avoid cleaning the cat litter box. If no one else can do it, they should wear disposable gloves and a mask. The litter box should be changed every single day. This is important because the oocysts are not infectious for at least 24 hours after being passed. Daily cleaning removes them before they become a danger. Advise patients to keep their cats indoors to prevent them from hunting and eating infected prey like mice or birds. Also, they should not feed their cats raw meat. Personal hygiene and environmental safety are also key teaching points. Remind patients to always wash their hands with soap and water after being outdoors. This is especially important after gardening or any contact with soil or sand. Recommend that they wear gloves when they are gardening or working with soil. If children have an outdoor sandpit, it should be covered when it is not being used. This prevents stray cats from using it as a litter box. These simple habits create a powerful barrier against the parasite and significantly reduce the risk of accidental ingestion of the oocysts. To summarize the key prevention tips for easy remembrance, use a simple checklist approach. First, cook meat fully. Second, wash all fruits and vegetables. Third, if you are at risk, do not change the cat litter. If you must, wear gloves and change it daily. Fourth, wear gloves for gardening. And fifth, always wash your hands thoroughly after handling raw meat, soil, or cat litter. By repeating these 5 clear actionable points, you can help your patients remember the most important ways to protect themselves and their families from toxoplasmosis. This is effective nursing in action.